Dear colleagues, welcome to the Department of Ophthalmology and Visual Science. I'm going to provide you with essential information about the course. It is slightly different than the courses you are having at other departments. The most important piece of information is actually sitting next to me. This is Kristina Popova, who is responsible for the administration at the department and who is going to help you with organization and administrative questions. First of all, I would like to point out that your lectures are starting at 7:30 on Friday, and each Friday you are going to have lecture in presence. Fortunately, we put your lectures in Blackboard as well. However, your presence at the lectures is compulsory. Second, you are going to have practical exercises. In our department, practical exercises are slightly different. We have something which is called rotational exercises, and I emphasize that those exercises which are 30 are within the first 6 weeks. So basically they start on the second week, and there are 6 consecutive exercises that you need to attend. During this time, you are going to cover 30 stations. The date of your exercises is starting on 21st of February, and it's going to be 6 consecutive weeks each Tuesday at 15:30. And the address is Doren 15, which is basically the specialized eye hospital Varna. So you need to be there about 15 minutes before in order to convene, because you are going to rotate during different stations. Also, you are going to have a different exercise which is called communication exercise. Communication exercise requires from you to do some preparation. We are running this exercise for more than 10 years, and it's usually very successful. The idea is that you are going to have a subject which is related to ophthalmic problem. Then you need to do your research. Then you need to prepare a presentation as a group work. And then you need to prepare a small video which basically is reflecting a clinical case according to your subject. So the deadline for the preparation of the PowerPoint presentation and video is 7th of April. So the PowerPoint presentation is usually around 5 slides, and you need to have on this presentation the subject. Of course, you need to have the etiology of the disease, the pathogenesis, clinical picture, differential diagnosis, and of course, treatment. Clinical cases you can present depending on your appreciation, but you need to have there a doctor, probably a nurse, patient, maybe somebody with the patient, especially if the patient is young, and then a dialogue need to highlight the clinical case that you are presenting. Your presentations are scheduled on 18th of April, which is again Tuesday. And we are going to inform you about who is going to present and how the presentations are going to go on. Another important thing is your surgical exercise. We did provide you with some information about surgery, including the most commonly performed surgical operations in ophthalmology in Blackboard. But during the surgical exercise, you are going to have some more interesting comments. Plus, we are hoping to have a live communication with the surgical theater. And this exercise is finishing with a test, which is part of your curriculum. If somebody cannot attend this exercise, although it's reasonable that everybody tries, you can sit your test within the next 10 days according to the schedule that you are going to be provided. But the test is important, and you have to sit the test because this is part of your final mark. And last but not least, you can have consultations with our assistants, and this can be done if you arrange this prior. So basically, if you miss exercise, you can have a consultation during the duties of the assistant, which are typically Saturday and Sunday, but you need to make the arrangement in advance because the assistant needs to make certain preparation for your presence. And I would like to point out that all the schedules and additional information with details is provided for you in Blackboard. So please read everything very carefully because this is important for you to understand the process. And then if you have more questions, you can address them with emails. Thank you very much. I would like to wish you good luck. I hope that you enjoy the course. I hope that you like ophthalmology because basically all of us are totally in love with this specialty. And of course, we are waiting for your participation in communication exercises because for the best team, we have a prize. Good luck.